All right, let's dive into today's topic. I'm calling it Navigating the Waves of Menopause, Physical Changes and Their Impact on Relationships. We're discussing menopause and the multitude of changes it introduces, especially concerning women's health and their intimate lives. Menopause generally makes its grand entrance between the ages of 45 to 55, bringing with it a significant decrease in estrogen levels and a host of changes.
Whoa, that's a wild way to think about it. So, if you don't take care of your bones, would they just fall apart like that old house down the street?
Exactly. If we neglect our bone health through proper diet and exercise, serious consequences could follow. And we can't overlook the potential mood swings, anxiety, or depression that come along for the ride. It really is like being on a mental roller coaster. Speaking of which, does sexual desire dip after menopause?
I guess that depends, right? Some people love roller coasters, and others hate them. So, does libido go down for everyone, or?
Great analogy. For some women, yes, libido can take a hit due to hormonal declines, especially with drops in estrogen and testosterone. But it's not a universal experience. Besides hormonal changes, physical issues like vaginal dryness and atrophy can make intercourse uncomfortable.
Ouch, that sounds really challenging. So, what can someone do about these issues? Are there fixes, or are they just stuck with it?
Absolutely, there are solutions. It's crucial to communicate openly with a healthcare provider. They can recommend treatments tailored to individual needs. For starters, using lubricants and vaginal moisturizers can work wonders. Have you ever heard anyone discuss how much a good moisturizer can change everything?
Oh, for sure. I mean, I use lotion all the time. So it's like, why not apply that to more intimate areas too?
Spot on. And there are also topical hormonal therapies, such as low-dose estrogen creams that can be prescribed. Regular sexual activity can create positive circulation, maintaining tissue elasticity. It's like keeping those buildings structurally sound.
That's a cool way to put it. But, is that always easy for couples to navigate? What if one partner is on board and the other isn't?
That's a crucial point. Yes, psychological factors like anxiety can indeed impact sexual desire. Communication becomes key. Partners need to be open with one another for mutual understanding and support. Plus, intimacy doesn't solely revolve around intercourse. Exploring broader ideas of connection can elevate emotional bonds.
So it's like discovering new adventures together? Like that time I went bungee jumping, thinking it would be a thrill. But it turned out to be super bonding when my friend and I squealed like kids on the way down.
Exactly. That's a perfect example. Maintaining a healthy lifestyle through exercise and nutrition isn't just about physical health. It can significantly boost mood and self-confidence too. Just like caring for your garden. If you nourish it properly, it blossoms.
Wow, that's so true. I guess growing older can feel scary, but you can still keep blooming.
That's the spirit. Today's discussion has hopefully shed some light on what can be a complicated journey. Remember, every woman's experience with menopause is unique. But with the right information and a supportive network, this transition can be navigated gracefully.
Thanks for all this insight. I can't wait to share this with some friends. See you next time.